that the trend of maternal mortality rate in Nigeria has not improved significantly in the last 3 decades, as the country's rating on the chart of countries with high maternal and child mortality rates dropped from 14th to 17th position over the period, in spite of all previous interventions. Worthy of note is that 70% of these deaths are preventable. The good news, however, is that key players on maternal and child health have come up with a wake-up call on the need to break the culture of silence over these preventable deaths, with the National Primary Healthcare Development Agency at the helm of the renewed impetus on reversing the trend of high maternal and child mortality in the country, a declaration of state of emergency on the ugly phenomenon, and a new approach to changing the narrative. Today on Health Options, we shall be looking at the new approach to reversing the trend of high maternal and child mortality in Nigeria. Diet is one of the most important factors in maintaining weight and a healthy lifestyle. But for some people, no matter how strictly you adhere to a diet, those pounds won't come off. It was this dilemma that led to one physician to conceive the idea of a blood type diet, under the assumption that our bodies process food differently based on our divergent blood types. So, make sure you don't miss out on the segment where we're going to take a look at food-blood compatibility. Thanks for staying with us on Health Options. Our policy track segment is taking a look at the trend of high maternal and child mortality in Nigeria. We take this background report on the factors responsible for Nigeria's high maternal and child mortality, put together by Uche Ugochukwu.
Under 5, maternal mortality rates have remained high in Nigeria despite interventions, although child mortality rates reduced by 20.4% from 27 deaths per 1,000 live births in 2013 to 24 deaths per 1,000 live births in 2015. To reverse this trend, experts advocate the identification of barriers to quality child and maternal health care towards proffering a lasting solution. Deaths in the first 28 days of life is linked to genetically induced malfunctions, premature births, status of a child, quality of antenatal care, which is whether there were skilled care before, during and after births. Deaths in the succeeding 11 months are associated with the wealth status of the household, environmental factors such as the cooking fuels, which lead to acute pneumonia and lower respiratory infections. Also, health behavior and nutritional practices were identified. Other factors include maternal education, early marriage, short birth intervals, breastfeeding practices, proximity of health facility, inadequate skilled health attendants, religion and cultural practices. These impending factors must be given prompt attention for Nigeria to meet the Sustainable Development Goals targets for maternal and child mortality, in spite of the recorded success in the reduction of child mortality.
To take us through the discussion is the Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency, Dr. Faisal Shoaib. It's good to have you again join us on Health Options, Dr. Faisal.
Thank you for having me, Rabi.
Nigeria's high maternal and child mortality is an unacceptable, situation. When you look at the fact that these deaths are 70% of these deaths are preventable. We read out the statistics out there during my introduction. But can you, maybe just give us some more, especially when it comes to the number of deaths occurring per live births?
And this has, made us at the Federal Ministry of Health, the National Primary Healthcare Development Agency, to say we cannot continue at this pace. We're not talking about chickens, we're not talking about rabbits, we're talking about human beings. Even one death is a death too much.
What really is amazing to me, is the fact that we've had a lot of interventions. So much investment has gone into, reversing the trend for so long. Why are we now making, seeing the desired results?
Right.
What happened to all those huge investments to ensure safe motherhood?
So, like I mentioned, right, we've made some progress, but the progress is not significant enough.
Why is the
So,
progress not
well,
significant?
a number of reasons. So, we still have issues around the lack of awareness. So, we still have women who get pregnant and do not go for antenatal care. They will rather deliver at home. There isn't enough skilled birth attendants to attend to these women. So, we now have these women who go into a bleeding event. Bleeding is the commonest cause of these deaths. When this bleeding occurs in the community, before they take the mothers to
That's
the health
bleeding
facility.
after delivery.
Yes, so, well, bleeding can happen even during pregnancy, but most times it is around childbirth that you have bleeding, and then after childbirth. That is the common cause of dying during childbirth. When that happens, there's no way to replace the blood, and the women die. If these births were occurring in a health facility, then of course the danger signs are there. There are trained personnel who will be able to ensure that those bleeding does not occur. If it occurs, there are ways to avoid it from claiming the life of the mother.
In terms of demand and supply, there has been concerted efforts in the past to provide commodities, essential commodities that will ensure that women have their babies without complications. So such that even when the complications arise, they should be able to, mitigate or stem them. What happened? Is it that we're not having those commodities anymore?
So you can have the commodities, right?
Yes.
In the health facilities, for example. But if the mothers do not come to the health facilities, there's a problem. This is how. This is what brings us to the critical reasons why we're losing women in our communities. The 3 delays. The first delay is the delay to take a decision to seek care, right?
Yes.
The second delay is the delay in reaching care. The third delay is that even when you reach where you should get care, getting good quality care becomes a challenge. So when you look at all of these delays, you can see that there are issues that are related to demand. So for the woman to leave her home and get to the health facility, taking that decision with her husband to leave the home when there are danger signs in pregnancy could be huge. It could be due to financial reasons, right? It could be to a number of cultural reasons where women still feel that it is a show of strength and ability to have their babies all by themselves. Sometimes they don't even tell people that they are having childbirth. Yes, they're in labor, right? In a lot of our rural communities, this still happens, right? Then there's also the issue that even when they take the decision to go to the health facility, they are not able to reach the health facility in time due to a number of reasons. It could be geographic reasons, right?
Logistics.
Exactly. It takes time. There's no transportation, or they live in rural areas, or they could be in riverine areas where getting help is difficult.
Okay, so we are in an era now. I'm just talking about the emergency, the state of emergency that had been, the agency just declared on the phenomenon. Let us into the new approach. What is it about? You're talking about, setting up a coordination center where you could track these deaths and find the causes and hold people accountable for actions and all of that. Can you tell Nigerians what is this new way of doing things that should give us that confidence that in no time we should see the instances coming down?
Right. So, in collaboration with the Federal Ministry of Health and under the leadership of the Honorable Minister of Health, Professor Isaac Adowale, we're setting up a center that we call the National Emergency Maternal and Child Health Intervention Center, where we will provide better coordination of all the efforts. In the last few decades, what we have seen are disparate, fragmented approaches, not only from governments, federal, state, but also our development partners who will come, take 3 LGAs here, take 2 LGAs in this state, run a program or a project rather for a few years, maybe 2-3 years, they leave and there's no continuity. What we're saying now is whatever lessons we have learned, how can we, sitting together, develop one plan And on that plan, we all align behind those plans, pull all the resources, right, that are required to rapidly implement the high impact interventions. We know what those high impact interventions are. Can we do it together in a coordinated way and pulling all those resources on the table in a transparent way and holding people accountable? So, for example, in terms of accountability, we've now gone into a partnership with the Gavi, with the Global Alliance for Vaccine and Immunization, with Airtel, to provide 10 toll-free lines where in the community, if any woman dies, if any child under 5 dies, they can call NPA CDA. We will triage these calls to the state primary health care boards, the state ministries of health, and find out what happened. Was it due to negligence at the primary health care level? Was it that in the communities, right, the traditional leaders are there, and we're collaborating with them, and they say that if any woman dies in the community, questions should be asked of the traditional leader, of the political leaders, of the opinion leaders. Why is it that when these women started showing the danger signs, all efforts were not mobilized to take her to the health facilities? When we have these kinds of reports coming in on a regular basis and people are investigating, then people will take note, right?
Yeah.
When we hold people accountable, we will, of course, reward those people who are doing the work the right way. But if people are negligent, then we will collaborate with the state governments. We will collaborate with the local governments to ensure that the right things are done. And this fits into the Basic Healthcare Provision Fund that has been provided by President Muhammadu Buhari to ensure that while on the one hand we're encouraging women to come for antenatal care, when they do go to the health facilities, that the commodities are there, the manpower is there to ensure that they receive care with dignity, with compassion, with integrity.
It's about, reduction by 50% by the year 2021.
Right.
And from what we're seeing now, you said at primary health care levels, we know that occurs, pregnancy-related complications occur even in the urban areas, regardless of. So how are we going to extend that to those other facilities?
Right. So the National Strategic Health Development Plan 2, right, that was provided by the Federal Ministry of Health under the leadership of the minister is very clear about what the roles and responsibilities of the Primary Healthcare Development Agency is. Most of these deaths occur in the communities. Over 70% of these deaths occur within the communities and the primary healthcare centers. That is why we say if we focus our resources there, right, it's easier for us to rapidly crash those deaths. In the secondary and tertiary healthcare centers, of course, we have better manpower in those areas, and we can look at what else we can do, working with all the development partners under one plan. Yes, we've said that we want to reduce these numbers by half by 2021. It is in line with what the Federal Ministry of Health has espoused, but we also are saying that it's either we go bold or we go home. We have to be ambitious because as a nation, these numbers we're seeing does not match our resources. It doesn't match the human resources. It doesn't match our financial resources. We can do better. And what we're saying is that we're going to raise the awareness. We're raising the ante and saying that we can do better. We cannot let our women continue to die in the communities.
Okay, as you coordinate, the states, the local governments also have their roles to play. How are you going to secure their buy-in into this new way, this new approach to reversing the trend of high maternal and child mortality?
From the get-go, in our conversations, we started from bottom up. So the states and the local government have been involved in these conversations. In our declaration, we had executive secretaries of the primary healthcare boards sitting there. They are completely aligned around the fact that enough is now enough. We have to do things differently. If we continue at the rate that we're going, of course, we're making some progress. But if we continue to reduce maternal and child mortality by approximately 5 to 6% every year, we will miss the Sustainable Development Goals target. So we have to improve on the rate at which we reduce maternal mortality. When we look at what has happened in other countries that have rapidly reduced maternal mortality, in the course of 5 years, The best we have seen is in a place like Botswana, where they reduced it by 53% over 5 years, right? So that is what we're trying to target. We're working with the states, we'll advocate to the governors, we'll advocate to the chairman, but we also want to advocate with the wives of the governors.
I was going to that, as mothers, as
absolutely.
You know.
We are going to make this the center of discussion, and we've seen from what the First Lady of Mrs. Aisha Buhari, she is very passionate about all issues relating to women, children, and reproductive health. We have been in conversation with her office. We're going to be working with her office and the offices of the First Ladies of the 36 states plus the Federal Capital Territory to see how they can bring, their nature to also get a better understanding and raise the clarion call that the time is now here for us to do better than what we're doing. And we are capable of doing it. So under the leadership of the Honorable Minister of Health, Professor Isaac Adewale, we are very positive that we'll make the huge investments that are necessary, and we will concomitantly see a rapid decline in the number of women that are dying, in the number of women and children that are dying from perfectly preventable causes.
Okay. On a more cheering note now, I discovered that we've been making some progress on routine immunization. What's the secret?
So this is what gives us confidence that we're going to be successful with crashing down the numbers of women and children dying, because we're using the same war room approach where everybody comes. We're moving from just strategies to actual execution. We are some 5 months away from being declared polio-free in Nigeria. We have increased routine immunization within a record period from some 47% in 2015. We have increased it to 57%. It's the same methodology that we used in stopping Ebola virus disease in Estrak in 2014. Those same strategies, those same rigorous execution and delivery is what we're going to use in crashing down maternal and child mortality.
This renewed vigor in reversing the trend. One is expecting that you and your team want to just hit the ground running from this moment. What are some of those things you've already started to put in place following that declaration?
Right, so we had our inaugural meeting with our development partners. We've set out all the different committees. We've looked and set out a work plan that will say very clearly when we must achieve particular milestones. We're reaching out to our development partners to provide support. We're also reaching out to our traditional and religious leaders. They are going to be very key in changing the behavior of our women, our men in the communities.
Health-seeking behaviors,
absolutely,
for pregnant
yes,
women.
Absolutely, they are going to be very, very key. That is why they are with us in the trenches. The Sultan of Sokoto is very passionate about this. We are with King Alfred of Bayelsa. Absolutely, they are very excited about all what we're doing. There are a few states where a lot of things have been done. There's no state that has excellent maternal and child health records. So some states are worse off than others, with every stakeholder to ensure that when the ranking of states and countries with poor maternal and child indices are reeled out, Nigeria does not continue to occupy a high rank.
So it will be right to say that it's the dawn of a new era for pregnant women and ensuring safe motherhood in the country.
You better believe it.
Okay, thank you so much, Dr. Faisal, for coming on Health Options again.
Thank you very much.
All right. Do you know your blood group and the food that is compatible with it? Let's find out.
Most of the time when we take food, it dissolves. It's either the food acts as a poison to the organs, or the food acts very beneficial in an atmosphere that the organs that are suspended, the cells, will be at the optimal performance. We have 4 major blood groups. It is not accidental. God has a purpose for it. And these 4 major blood groups, the major ones is either you are A, you are AB, you are O, and you are B. Irrespective of your race, it has a reason. And when you now look at it, the food has the blood has antigens that the chemical substance in food do react to. And this goes a long way to determine a lot of factors, a lot of components that can be of good health and that can be of ill health. The knowledge of your blood group compatibility. A positive person, by nature, by God's existence, you are meant to be a vegetarian. The blood is compatible with vegetables. Most of the time, as a A positive person, yes, you are active. Your blood is so sensitive. And whenever you take anything that is not of vegetable origin, most of the time, it's either it's not beneficial to you or it serves as a poison. As O positive person, for example, they are carnivorous naturally. They need meat. Meanwhile, as a positive person, meat acts like a poison to you. Most of the time, the blood group compatibility actually goes a long way. For example, a positive person, you are not the type that should be involved in too much physical activity. Once you understand your blood group and what is compatible with your blood group, it goes a long way. I indulge women, learn about the blood group of your child. If a positive person can do without meat, you will, and stay more of the fish and more of vegetables, it goes a long way. As O positive person, you need the meat. They are naturally carnivorous and they are more physical. They need a lot of physical exercises to be hale and hearty. And now you are a A positive person, you want to compare yourself with an O person. No. Alkalinity affects A positive more than anybody. And most of the time when the food is not incongruent with the blood, for an A positive person, autoimmunity problem is their challenges. And that's why they develop a lot of autoimmune system. They develop cancer is a major thing that can develop continuous acidity of a typical A+ person. An A positive person needs an alkaline environment, and that's why it's advisable, even if it is lemon in your water every day, it will take you a long way that you will avoid going to hospital. We are not saying people should not go to the hospital. Yes, it's good to go to the hospital to do some basic major tests. But the workload on a hospital will definitely reduce by the knowledge of this compatibility with your blood type. But all positive persons, see, they do well in a meat environment. It's not that too much of it is not good, but you cannot afford to be a vegetarian as an O positive person because you need this meat in you. So by understanding your blood group, you know your challenges. And most of the problem of O positive is their gastric acid. Most of them suffer from ulcer. At least about 70% of them, ulcer is a major problem. I am A positive, I am B positive, I am O positive. And these are the likely things that an O positive challenges they face health-wise. Because majorly ulcer, B people, they have problem with their BP, their sugar. That is the common problem they do have. What is your blood group? What is that type of exercise that is good with your blood? What is that food that I do like and I've been taking? And actually it is more harmful. So naturally, as a person, it goes a long way to help us in sustaining a healthy life. Knowing your blood group helps you to know the type of diseases or problems that you might likely face and challenges. So when a typical B person now knows that, okay, the problem I might likely face is a BP problem and sugar problem. So as early as possible, you have to be very cautious of it. And that's why you see most B, by the time they are 50, they are likely to be hypertensive and diabetic if they are not conscious of what they do.
This is is where we end it on this week's edition of Health Options. You can watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah. Thanks for watching. Hope to see you again.